The Mary Pack Arthritis Program provides a multidisciplinary team approach to assessing and treating a variety of inflammatory and degenerative arthritis conditions. This video will demonstrate a spinal assessment for a spondyloarthritis patient with inflammatory back pain, such as ankylosing spondylitis. Typical postural changes that can occur because of the inflammatory process in the spine include flattening of the lumbar spine, tightness of the hip flexors, and an increase in the thoracic curve. While more advanced cases include forward head posture, increase in kyphosis, flattening of the chest wall, and protrusion of the abdomen. If you have a patient diagnosed with inflammatory back pain, you will want to perform a spinal assessment to guide your physical therapy treatment plan and exercise program, and monitor the effectiveness of your treatment. This video will demonstrate 8 standardized measures. Before you begin, you will need some basic equipment to perform these measures: a pen, a flexible tape measure, some wall space, and a plinth. Try to perform the measurements at the same time of day and before your treatment intervention. Also, make note of any modified positioning. To measure posture, we use the tragus to wall test. Have the patient stand in bare feet, their back against the wall and keeping their feet shoulder width apart. Ask the patient to keep their heels, buttocks, shoulder blades, and head against the wall with their chin tucked in. Patients who have difficulty getting their head to touch the wall will want to lift their chin to compensate. Make sure to correct this and keep the chin down before measuring. Using the tape measure, measure the distance from the tragus to the wall and repeat on the other side. The tragus to wall test helps you identify any asymmetry between sides. To measure trunk lateral flexion, we use the tape measure method. This movement has a warm-up effect, so have the patient bend sideways 3 times before measuring. Measure and record the distance between the medial malleoli, so when you reassess, the feet are the same distance apart. In the upright position, ask the patient to extend their fingers at their side. Measure the distance from the longest fingertip to the floor. Then ask the patient to bend sideways. Watch that the patient doesn't twist or come away from the wall or lift their heel off the ground. Measure fingertip to floor again. Record the difference between measurements, then repeat these steps on the other side. To measure trunk flexion, we use the modified Schober's test. Have the patient stand erect. Using the posterior superior iliac spine, the PSIS landmarks, place a mark in the center between these 2 points. Then mark the skin 10 centimeters above and 5 centimeters below this point. The rationale for measuring 5 centimeters below is because the skin is more tethered there, and this provides a more accurate starting point for the measurement. Ask the patient to bend forward and measure the distance between these 2 points. Record the change. To measure trunk flexion extension, we use the Smythe test. Using the same landmark between the PSISs, have the patient bend forward and measure 3 consecutive 10 centimeter segments and mark them. Then position the patient prone on the plinth and ask the patient to push up using their hands, extending their back while keeping the pelvis on the bed. If patients are unable to lie prone, have them face the wall with pelvis as close as possible, hands on the wall, and then ask them to lean back. Record the change in each segment. To measure spinal rotation, we use the tape measure. Ask the patient to stand erect and place the tape measure at the zippy sternum. Bring the other end of the tape around the trunk to the earlier mark on the back at the PSIS level. Note this measurement. Then ask the patient to turn their body to the opposite side and record the change. Repeat on the other side. These measurements correlate strongly with joint changes on X-ray. To measure chest expansion, we use the tape measure. Have the patient stand erect. Place the tape measure at the zippy sternum level around the rib cage. Then measure the difference between maximal inspiration and expiration and record. Although the literature does not recommend more than one repetition, in clinical practice we find there is a warm-up effect, so repeating 3 times and taking the largest value is more accurate. To measure cervical side flexion, we use the tape measure method, or a cervical range of motion instrument, the Chrome. This movement has a warm-up effect, so have the patient bend their head 3 times to each side before measurement. With the patient sitting, place the tape measure between the tragus and the tip of the clavicle. Record that distance. Then ask the patient to side bend their head to that side. Watch for patients trying to turn their chin to gain more movement. Remeasure and record the difference. Repeat on the other side. These measures correlate strongly with joint changes on X-ray in the cervical spine. To measure cervical rotation, we use the tape measure method. This movement also has a warm-up effect, so have the patient turn his head 3 times to each side before measurement. With the patient sitting, place the tape measure between the chin and tip of clavicle. Record the measurement, and then ask the patient to turn their head to that side. Watch for patients lifting their chin when turning their head and correct. Remeasure and record the difference. Repeat on the other side. Cervical rotation correlates strongly with joint changes on X-ray in the cervical spine. This completes the demonstration of 8 spinal measurements for use in inflammatory back pain and spondyloarthritis. For more information on the management of this condition and other forms of arthritis, visit our website at mpap.vch.ca.